Hi everyone, my name is Smriti Mishra and I'm a senior clinical dietitian, a registered dietitian, certified wellness expert and a wellness consultant. Today, I will be discussing on emerging trends in advanced nutrition therapy for patients with dilated cardiomyopathy. Before I begin, I would like to extend my sincere gratitude to UN Mehta Hospital and senior dietitian Ms. Poonam for granting me this opportunity to present today. It is truly an honor to share my knowledge and insights on advanced nutrition therapy in dilated cardiomyopathy with all of you. I believe that this presentation will not only be informative but also serve as a valuable learning experience for everyone involved here. So let's embark on this journey together and explore the significant role of nutrition in patients with dilated cardiomyopathy. So in this presentation, we will learn about uh, firstly the overview of dilated cardiomyopathy and its impact on cardiac functions. Then the importance of advanced nutrition therapy in managing patients with dilated cardiomyopathy. The role of specific nutrients that we as a dietitian termed it as a key nutrient, that is L-carnitine, taurine, thiamine, selenium, coenzyme Q, and vitamin D in managing dilated cardiomyopathy. We will also learn about the benefits of fluid and sodium restriction, the dietary recommendation and meal planning strategies and tips, the potential benefits and consideration of supplement doses while planning in patients with dilated cardiomyopathy, the impact of nutrition intervention on disease progression, symptoms, and overall lifestyle improvement in such patients. We will also learn about practical strategies for implementing nutrition therapy in care of patients with dilated cardiomyopathy and the importance of ongoing monitoring and collaboration with healthcare professionals. So this is a teamwork. So this everything I will be covering in my presentation, and also at the end I will be sharing one case study with all of you. This case study I had conducted in UN Mehta Hospital itself in the span of 2 years when I was working there as a clinical dietitian. And lastly, I had also made few questions and answer for my fellow dietitians, and I'm sure that would going to be very beneficial and helpful. Okay, so let's begin with dilated cardiomyopathy. So dilated cardiomyopathy, also termed shortly as DCM, is a specific type of heart condition that is characterized by an enlarged and weakened heart muscles. In DCM, the walls of the heart ventricle become thin and stretched, which leads to reduced pumping efficiency. It primarily affects the left ventricle, but it can also impact the right ventricle and both atria. It can result in impairment of heart functions that leads to the symptoms such as fatigue, shortness of breath, swelling in the legs, and irregular heartbeats. The exact cause of DCM is often unknown, and it can occur in individuals of any age. So we cannot say that in particular age patients are prone to DCM. It can happen in any of the age as per the research. DCM can also lead to complications such as heart failure, blood clots, arrhythmias, and sometimes sudden cardiac arrest. Diagnosis of dilated cardiomyopathy involves a thorough medical evaluation, including medical history, physical examinations, imaging tests like echocardiogram, and sometimes genetic testing is required. The treatment for dilated cardiomyopathy focuses on managing symptoms, improving heart functions, and preventing complications. It may include medications such as beta blockers, ACE inhibitors, or diuretics, lifestyle modifications such as dietary changes and regular exercise, implanted devices like pacemakers or defibrillators, and in several cases, heart transplantation. So here again, regular monitoring and follow-up is required. Here you can see in the picture, it is clearly shown that in normal heart, there's a clear myocardium, and you can see the ventricle part, this the normal area that here you can see. But in case of this dilated cardiomyopathy, you can see here the area is enlarged. Okay, so this is the you can identify easily. This is the reason why it is called dilated cardiomyopathy. To get it in details, I have made a tabular form to show the difference between normal heart and a heart with DCM. Firstly, I would like to take your attention towards this picture. See how the normal heart functioning is here, and here is the cardiomyopathy. Here is the heart with dilated cardiomyopathy, where enlarged ventricle we can see. And in another picture, this is hypertrophic cardiomyopathy, where the thickened septum can be seen. Okay, so we will not go in the very details of these diseases, because once the doctor diagnosed with dilated cardiomyopathy, then the patient will approach to healthcare professionals like clinical dietitians and physios and all. So, but yes, we must aware of this disease clinically, and I always suggest my fellow dietitian to do ask to their physician or treating doctors about the disease if they have any confusion, because if you do not know the disease, you cannot be able to manage the disease as per the diet, the dietary recommendation you want to suggest. Okay, so let's understand what is the difference between the normal heart and in the case of dilated cardiomyopathy. So I have made this in a tabular form. What happens is normal heart. The normal heart is a healthy heart that has a normal size and structure with four chambers, that is two atria and two ventricles, that mostly functions properly and normal. That is why it is called a normal heart. But in the case of DCM, the heart becomes enlarged and weakened. The walls of the ventricles become stretched and thin, leading to decreased pumping efficiency. So there is a difference in the normal heart and heart with DCM about the pumping function. In normal heart, the it pumps throughout the body, okay. But in the case of DCM, heart's pumping function is impaired, and the weakened heart muscles struggle to contract forcefully, resulting in reduced blood flow and decreased delivery of oxygen and nutrients. The next difference is of ejection fraction, that is commonly known as EF. In normal heart, it refers to the percentage of blood that the heart pumps out with each contraction. And in a healthy heart, the ejection fraction is typically 55% or higher. But in the case of DCM, it is significantly reduced. It may fall below 40%. So see, there's a huge difference here between the normal heart and when a heart is in DCM. What are the other symptoms and complications involved? So in normal heart, it functions without causing noticeable symptoms or complications. Like if I say, in my case, I have no other complication. It's a normal heart, so it is functioning normally, and I don't feel like any symptoms. So that would be termed as, that would be called as, okay, the heart is functioning normally. But in the case of DCM, the symptoms include fatigue, shortness of breath, swelling in the legs, ankles, irregular heartbeat, that is also called as arrhythmias, and fluid retention. It can also lead to serious complications like heart failures, blood clots, and sudden cardiac arrest. So, if the patient comes with these symptoms, the treating doctor will suggest and advise the medication accordingly. Now come to the treatment part. So in normal condition, when your heart is functioning normally, it doesn't require any specific treatment or any targeted treatment. But in the case of DCM, it may involve medications to improve heart functions, lifestyle modification, that is the dietary changes and the exercise, the targeted exercise, implanted devices like pacemakers or defibrillators, and in some cases, heart transplantation is also suggested by physicians, by doctors. So these were the differences in the treatment, and the cause that I had already mentioned in the previous slide. So a normal heart is not affected by any underlying disease or conditions, but in case of DCM, it can have various causes, including genetic factors, viral infections, or certain medications, alcohol or drug abuse, autoimmune disorders, and exposure to toxins. So this was the major difference between a normal heart and in the case of DCM, and I'm sure now the difference is clear, and uh, it is very clearly understood what all changes we can see in DCM. Okay, so let's move to the next slide. See, it is important to note that dilated cardiomyopathy is a medical condition that requires proper diagnosis and treatment by the doctors. But the overall, uh, the healthcare communication, I mean, other than the doctor, the communication between healthcare professionals is also very crucial here. The differences monitored above, like in the case of dilated cardiomyopathy, these are the changes when doctors come to know, and when doctor advise the particular medication, or sometimes in case of obese patients or overweight patients, to go for weight management, do certain exercises and all. Then in such conditions, patient is supposed to go to the clinical dietitians and physiotherapists further for further line of treatment. So because overall, every healthcare professional has specific functions, like a dietitian will suggest about the weight management, about the particular nutrient that you need to follow. So overall, the motto is to bring a lifestyle change on day-to-day basis, and this will be done when clear communication between doctor and healthcare professional will be there. So it is always advised that a proper communication should develop and that work in the interest of patients. Okay. Now we are moving to the next slide, where we will understand about the heart healthy diet. Okay. So why heart healthy diet or cardiac diet is required for patients with dilated cardiomyopathy? So these are the key points that I think we should understand and apply while managing such patients. So heart healthy diet is essential for patients with DCM to reduce the workload on their heart and promotes their cardiovascular health. This kind of diet should be focused, and it is advised to consume low sodium, low fat diet, although nutrient dense diet, it should not be like low calorie or something like. The diet should be nutrient dense, give enough calories, that is as per the requirement of the patient. And of course, fluid and sodium restriction will always be as per the doctor's advice. And in your diet, you can advise a patient for the low fat diet to include. So this I will elaborate in my further slides, what kind of diet strategies you can make and then prescribe your diet chart to the patients. Okay, another point is encourage to limit processed food. Check the assessment of the patient. If you come to know that patient is very prone to eating outside or having outside food, try to counsel the patient to limit outside food, processed food, added sugars and unhealthy fats, because this overall going to take extra toll on their health. Another point is taking optimal nutrient intake. Then comes to disease management. Now, disease management is a very elaborated steps. You manage the disease by taking proper medication, good food that is healthy and required diet, and then exercise as per your activity level. So this overall will help to manage your disease. Okay, and last is to addressing comorbidities. So when you go to the doctor for follow-up sessions and all, then your doctor will come to know and then advise accordingly. If there is any comorbidity, doctor will advise you accordingly what should be the next steps taken. Okay, so this is um, about the cardiac diet and its important. Now let's understand what are the key nutrients involved in cardiac diet, and the diet specially designed for patients with dilated cardiomyopathy. So here are the key nutrients that we as a dietitian need to focus on. This is coenzyme Q10. Another one is omega-3 fatty acids. Another one, magnesium. And next is vitamin D. Coenzyme Q10, it plays a vital role in energy production and in many biochemical reaction that happens in our body when the after the digestion process takes place inside. So it plays a very important role here. It also improves heart function. So whenever you are suggesting any supplementation, so that I will advise, do it under medical supervision. Let your doctor be informed. You can always suggest if the particular supplement you think you should include in the diet. You can always suggest this to the doctor and take his or her advice. Second is omega-3 fatty acid. These are the healthy fatty acids and it has anti-inflammatory properties which may also reduce the risk of arrhythmias. So the research says that it has a very important role in managing dilated cardiomyopathy. What are the key sources for omega-3 fatty acids? So among non-vegetarian sources, fatty fish are a good source of omega-3 fatty acids. And among vegetarian sources, flax seeds, walnuts, these are the good sources of omega-3 fatty acids. So you can include it in the diet on a regular basis. There are supplements available for omega-3 fatty acids both as a vegetarian and non-vegetarian sources. So you can also suggest such supplement if or when it is required. Next is magnesium. Magnesium is uh, known to maintain a normal heart rhythm. So this element is very crucial, and its good sources are leaf green vegetables, nuts and seeds. So the seeds, so the sources are commonly available, and you can easily include in day-to-day basis. Another one is vitamin D. Vitamin D is also one of the crucial key nutrient while managing DCM patients. So, and we all know the best source of vitamin D is exposure to sunlight. We also have some fortified foods available in the market that we can have as a source of vitamin D. So these are the key nutrients that we need to focus on while planning the diet for patients with dilated cardiomyopathy. Always try to include the natural sources first, and then, like in the case of CoQ10, you need to include supplement. So if the omega 3 fatty acid, magnesium, and vitamin D you are covering through diet, it's okay to have one supplement from outside. Okay, so after this key nutrients, I'm sure you will now have a clear picture of what are the specific or focused nutrients that you want to include in your diet. So next is we will come to the restriction part now. So sodium restriction and fluid restriction we will be talking about. So let's come to sodium restriction first. Okay, so sodium restriction is another crucial thing for the patients with dilated cardiomyopathy, as it helps control fluid retention and also reduces the workload on the heart. It is advised that those patients who have dilated cardiomyopathy, they should limit the sodium intake, and it is advised to have less than 2000 mg per day sodium on regular basis. So, as a dietitian, you encourage patients to learn more about food levels, to any food packets. If you just turn it around, there is a nutrient specification is written. So, just go through it, read the levels, understand the uh, how much is the sodium level present in that particular food items, and accordingly you can use it. There are two sources of sodium. One is visible source and second is invisible source. Visible source is what you can see, like how much salt you are putting in your food. That is a visual source. You are understanding, you are viewing, you are seeing how much sodium you are putting in. Another is invisible source of sodium. That is, in a suppose you are taking one packet of chips or a namkeen, and you end up eating, entire packet, and later when you see at the back of the packet, you see, oh my god, that was 3000 mg of sodium in a single packet. So that was that you took invisibly and unknowingly. You don't know how much sodium you had consumed. So it's always wise to look at the backside of the any food packets, read the labels, understand the nutrition information, and then use it accordingly. If you have any question, any confusion, please ask prior to the consumption. Okay. Okay. So this was sodium restriction. Now let's move to the another restriction about fluid restriction. So how you will manage fluid? And okay, I'll repeat it once again. I thought there was some network issue. Okay. So another restriction is fluid management. Fluid management is essential to prevent fluid overload in patients with dilated cardiomyopathy, and it is always advised to the patient to monitor their fluid intake. Now, again, like how you were managing sodium, both the visible source and invisible source, same principle apply while managing fluid. Whatever beverage you can see, okay, like tea, coffee, milk, juice, soup, that you can see, that is the visible source of fluid. Now, in some food items, the water content is on higher side, like cucumber, mint, watermelon. These are the food sources which are high in water content. So, if you are on fluid restriction diet, you have to take everything into consideration. And individualized fluid restriction is based on each patient's condition and fluid balance. So, one formula for everyone is not going to work here. Again, after doctor advice, you should visit to your clinical dietitian, take her advice or his advice, how the dietitian is planning your diet and explaining you about the fluid. And it is advisable that to keep measuring cups or glass with you, so that you have an idea, like if you have 1 to 1.5 liter of fluid restriction in a day, you should have the measured cups or a bottle, so that you will able to understand, okay, this amount is advisable, and how you have to, you know, make it consumable in whole day. Like if 1 liter is the restriction, in whole day you have to take 1 liter. So divide it for morning, lunch, and dinner, and for your cooking purpose. So how you will manage that, up to you. That is actually up to your comfort, how you are going to manage it. So that is always up to the patients. But the fluid restrictions, sources, this everything should be counseled in advance and in very explained, explaining manner. What are the food sources that are rich in water content? How much water is there? And if the person is feeling very thirsty, then the patient or that person can have ice cubes, like he or she can chew it, and that will help to satiate the, quench the thirst. So accordingly, we manage the fluid part. Now, uh, we'll come to the most important slide for clinical dietitians, the diet plan strategy slide. Okay, so developing a diet plan involves considering various factors such as individual goals, dietary restrictions, preference, and overall health. While I can provide a general framework, it's essential to consult with a registered dietitian or healthcare professionals for a personalized diet plan. But here is a detailed strategy to create a healthy diet plan. So what you're going to do is, as a clinical dietitian, first you will determine goals and needs. So after the assessment part, you finish up the assessment, you will come to know and identify your specific goals, that whether the patient requires weight loss, weight management, weight gain sometimes, or you have to improve overall health if the patient sounds weak, fragile, and malnourished, how to manage that medical condition, or how to enhance the athletic performance and all, because you have all sorts of patients. It's not only the normal normal person was going to who is going to office, or going to um, work. Some persons are into sports, so everything you have to keep in mind. So first is you do assessment, determine the goals and the needs. Then come to the calorie and macronutrient requirement part. So first you will calculate the daily calorie needs based on your goals, the goals that you have set. Okay, and this can be done using formulas like Harris-Benedict equation. There are some formulas by which a dietitian prescribe this amount of calorie you need per day. So that is the dietitian part. Um, Now, after calculating your daily calories, the dietitians will determine the optimal distribution of macronutrients. So macronutrients are what? The nutrient that required in large amount Like on everyday basis, we need carbohydrates, proteins, and fats. These are the the most important nutrient that we need every day, and these are the macronutrients. So this is also based on the goals set. Now, a balanced approach is generally recommended with a focus on nutrient dense whole foods. So, the main goal is to bring the patient on balanced diet. So, set your goal, calculate the calories and macronutrient. Then come to portion control and balanced meal. Uh, Plan portion sizes to ensure you consume appropriate quantities of food. So dietitian always, make sure to advise you for the appropriate quantity of food. And this may involve using measuring cups or some food scales. Like before I said, to manage and monitor you properly, dietitian may advise to sometimes have very measured food items. So don't be so confused with it. Oh, now I have to bring cups and scales in. This is just to have a idea. So while counseling session, dietitian will make you understand everything. So this is the patient part that I am discussing. How dietitian used to counsel the patients. So, portion control and the balanced meal will be counseled, and then um dietitian will help create a balanced meal by including variety of food items, by taking your choices. I mean, by taking patients' choices into consideration. So, to understand patients' food habits and food religion and all everything into consideration, the meal is planned, the meal is, and if the patient is in hospital, the meal is prepared accordingly. So among different food groups, in carbohydrates, mostly whole grains is suggested. Okay, for proteins, legumes, and whole pulses, and among the non-veg sources, poultry, fish, beans, and other than that, lentils, tofu, soy products, dairy dairy items. These are the sources of protein, and that is required for your muscle repair and satiety. Another macronutrient is fats, and for fats, like I mentioned in my previous slide, that always healthy fats is suggested by your dietitian. So include more of healthy fat sources, but again that depends on uh, the patient's economic condition also. If the patient is able to buy or purchase all the such items, because these healthy fats are sometimes higher on cost. So this should be one of the a very important point that dietitian need to consider it while uh, planning and suggesting the healthy fats in the diet. Because like some of the food items like avocado and some seeds oil and cold pressed oil, so these oils are generally on higher on cost. So plan it accordingly. Uh, Ask the patient whether he or she is able to manage it or not. Okay. If not, you can give the another sources. It doesn't mean that only those food items which are higher on cost will give you the best results. There is always a good alternative that dietitian can use and plan into the diet. And in meal planning and preparation, plan your meals. Just suggest the patient to plan your meals at home only. That would be very safe, and uh, actually that is mostly counsel. Everybody will advise you to please have a home cooked food, because you know what you are going to, which oil you are going to use, you know. And outside food you have no idea what they're using, which oil, which cooking medium that they're using. So always use home food or food cooked at home, and then ensure a balanced diet is given to the patient or advice to the patients. Include a combination of nutrient-dense foods from all food groups, be it carbohydrate, protein, fats, um, dairy products, and for vitamins and minerals, fruits, green leafy vegetables, because green leafy vegetables is also a very good source of magnesium. So try to make it a balanced diet by including all the food group sources. Okay, and opt for whole and minimally processed foods and limit processed and refined options. In continuation with the diet plan strategy, so the another important element is hydration. So uh, it is always advised to stay adequately hydrated by drinking water throughout the day. Even you have fluid restriction, try to manage it and keep yourself hydrated throughout the day. Okay, and limit sugary beverages including soda, fruit juices, energy drinks, etc. It's always advised to have more of the fruits rather than juices and the fancy fruits items, because if you are eating fruits as a whole, it will also add on the fibers that your body is required. And practice healthy eating habits. Practice mindful eating by paying attention to hunger and fullness cue. Eat slowly and just savor each bite. That will give you the contentment part also. Okay, so and include a variety of colorful fruits and vegetables to ensure a wide range of nutrients. Like before I suggest you that you are you as if you are a patient with diabetic cardiomyopathy, you must limit added sugar, sodium, saturated fats, and trans fats rich food items. So always have a check on that and incorporate the sources of dietary fiber for digestive health and satiety. So include more of the seasonal fruits and vegetables. Consider any dietary restrictions or allergies if you may have when selecting food, or when dietitian is planning your diet, patient is supposed to share everything related to allergy or intolerance of certain food items. Then monitoring and adjustment happens. Then dietitian come to know, okay, if you have some allergies or intolerance, then the alternative will be given. So food is monitored and adjusted accordingly. The regular follow-up is required to meet your goals, and patients are required to keep track of the local food intake. So it's always advisable to have a food diary or maintain or you can also use some digital mobile apps. Okay, so this will help to stay accountable, and you can also evaluate, you as a dietitian can evaluate how the body is responding to the diet plan. So if there's certain adjustment is required, you can make it accordingly. Always emphasize fiber rich foods like whole grains, fruits, and vegetable for overall cardiovascular health. And at the last, include supplements if required. Okay, so supplement is not a must, but after doing assessment, if you will understand, okay, this patient needs some extra nutrient and that is not in the diet part, then you can always suggest one supplement, and that is again keeping food habits and food religion into consideration. If patient is vegetarian, include vegetarian source. If the patient eats non-vegetarian, then you can include non-vegetarian source of supplement. Okay, so now I think we are very clear on the diet plan strategy part. Now we'll moving to the supplement that should be considered. So when planning a diet for patients with dilated cardiomyopathy, it's essential to consider the role of dietary supplements in supporting their overall health and well-being. Supplements should not replace a balanced diet, but may be beneficial in certain cases to address specific nutrient deficiencies or support cardiac functions. However, it's important to note that the use of dietary supplements should be approached with caution and under the guidance of clinical dietitians. And here are some supplement consideration to keep in mind for patients with dilated cardiomyopathy. So these are the supplements that I have listed in. Um, like omega-3 fatty acids, vitamin D supplement, coenzyme Q10, some of the antioxidants like selenium supplements, amino acid-rich supplements like L-carnitine, taurine, thiamine, in the B1, coenzyme Q10. So these are the supplements that you can include while planning the diet for the patients with dilated cardiomyopathy. However, more research is needed to establish its effectiveness, and individual needs may vary. So it's always good to consult with healthcare professionals for use, uses and doses. Okay, so it is advised not to take over-the-counter supplements. Always take prior advice to your doctor or from a clinical dietitian. And some of the cautions that we need to take care of is emphasize the use of supplement, and that should not be taken lightly and should be discussed. It should always be discussed that sometimes it happens that if a patient has some allergy or intolerance with certain items, and the patient directly just take any of the supplement from over the counter, so that is a very wrong step. You need to discuss it with dietitians or doctor, and then you go to take any of the supplements. Okay, because you as a patient may miss, or if there is a habit to read all the nutrition guidelines, and at the back of the supplement, if you read everything and you understand, then it is fine. But if you have any small confusion or query, do ask in advance and then jump to a conclusion that what supplement you should take in. Okay, so this was the supplement part. I'm sure now the dietitian will have a clear idea what kind of supplement to be focused in the diet, and how they can manage it. Okay, so now let's move to the weight management part. Okay. Weight management is an essential component of maintaining overall health and well-being. Effective weight management involves achieving and maintaining a healthy body weight through a combination of balanced eating, regular physical activity, and behavior modification. The primary goal of weight management is to achieve a healthy weight that is sustainable and promotes optimum health outcomes. So it is important to know that weight management is not solely about achieving a certain number on the scale, but rather focusing on overall health and body composition. When discussing weight management, it is crucial to emphasize the importance of adopting a gradual and sustainable approach rather than resorting to quick fix details or extreme measures. So, a balanced and nutritious diet is a key aspect of weight management. So, patients are encouraged to focus on whole, unprocessed foods, including fruits, vegetables, lean proteins, whole grains, and healthy fats. Patients are also advised for portion control size, then regular physical activity. It's also important to address the psychological and behavioral aspects of weight management. So, dietitian will discuss everything in detail, and also come with the strategies for stress management, emotional eating, developing healthy habits, and coping up the mechanism. Support and accountability play a significant role here in managing your weight. So, as a dietitian, you encourage your patients to seek support from the healthcare professionals, like uh, to from the dietitians and the other support staffs. So this will also help them stay motivated and receive a proper guidance to tailor their specific needs. Weight management is a long-term commitment, and it's important to emphasize that progress may vary among individuals. So encourage patients to focus on sustainable lifestyle changes rather than short-term. results. Because ultimately weight management should prioritize overall health and well-being rather than solely focusing on achieving a specific weight. It's about creating a healthy and balanced lifestyle that individuals can maintain in the long run. So I think it's enough on weight management part, and now let's move to the next slide where I will be discussing on the potential challenges and solutions. So, patients with dilated cardiomyopathy may face challenges in adhering to dietary restrictions and lifestyle changes. So, it's sometimes very emotional part. So, emotional eating, stress, and anxiety, and all. So, everything should be clearly counseled while you are planning a diet. So, prior to that, you take the assessment, understand the emotional part, and then you go to diet management. Provide proper education and support to help patients understand the importance of nutrition therapy and overcome barriers. So it's very unfortunate that in this era also, majority of patients entirely depends on doctors for their treatment. Diet is one of the crucial part of the treatment. Doctors understand that the patient needs time. They will take time to understand it. So it is always requested, and uh, it is requested to the doctor to please make their patient aware about the diet as a one of the important element of their treatment. So visit your clinical dietitian or your physiotherapist or the other support workers to understand and then bring a good lifestyle changes. So proper education and support is required, and collaboration. This is called a team approach. So collaboration and team approach is very much required. Okay, so these were the challenges and solutions. The last, we have come to the end of my presentation. This is the monitoring and follow. So this step is what it gives you the clear picture of your setting the goal and managing part. So regular monitoring of nutritional status, weight and dietary adherence is essential for managing patients with dilated cardiomyopathy. So it's always good to schedule a follow-up appointment, okay, and talk, discuss and understand from the patients about their difficulties, or if everything is going good, that's a plus plus. So try to understand everything in your follow-up sessions. Encourage open communication between you and your patients. Okay, so to conclude, I can say advanced nutrition therapy plays a very crucial role in managing dilated cardiomyopathy and improving patients' outcomes. Emphasize the importance of heart healthy diet, sodium restriction, fluid restriction, uh, excuse me, and weight management part. Individualize the nutrition therapy plan based on each patient's need, and collaborate with a multidisciplinary team for optimal care. Alright, so I hope you all find this presentation meaningful. And now I'm thrilled to share with you all about my research study that was conducted in UNMICRC Hospital in Ahmedabad from 2009 to 2011. So this study was aimed to evaluate the effectiveness of advanced dietary intervention in patients diagnosed with dilated cardiomyopathy. So I had taken 250 patients in the 2 years of span, and optimum diet planning counseling was implemented. The patients were advised to incorporate all the key nutrients that I had mentioned in my previous slides, that is omega-3 fatty acids, CoQ10, magnesium, vitamin D sources, magnesium and all. And this study was aimed to assess the impact of this dietary intervention on the management and outcomes of patients with dilated cardiomyopathy. the major inclusion criteria was I had selected the patient who were under the 60 years of age and had LVEF less than 45%. Patients were mostly on salt restriction and fluid restrictions, and advanced nutrition intervention in therapeutic diet planning for patients with dilated cardiomyopathy. So, so this was the nutrition balance design, and that includes the patient with dilated cardiomyopathy, age below 45 years. Patient observed were under food restriction and nutritional advice in the experimental group, and the rest were on the standard medication. The primary objective of this study was to evaluate the effectiveness of nutrition intervention. That includes all the key nutrients that I had mentioned earlier. The study was aimed to assess the impact of this intervention on reducing the effects of disease condition and improving overall lifestyle changes in the participants as well as patients. Okay, so this was the analyzed patient pool. So in you can see here in the experimental group, there were total 150 patients, and they were on fluid restriction less than 1.5 liter in a day, and sodium restriction was up to 2 grams per day. So the diet rich in selenium, thiamine, taurine, coenzyme Q, L-carnitine. So these were the dietary guidelines that was taken care of and was counseled to the patient. While on control group, there were 100 patients and they were on normal diet. So after the assessment, they were advised to take continue with their the way they are taking their diet. Of course, processed food and outside food was suggested not to include, and monthly follow-up. Mostly monthly follow-up was done. So the primary endpoint I got it was the significant reduction in the hospitalization rate also, and the secondary endpoint was the patient came up with a better quality of life. So this lifestyle change was a very important endpoint that I met with, and their other symptoms were also got lowered, like the other symptoms like tachycardia, dyspnea, and edema. The associated symptoms were also found to be lower side. So after this study done, I came to conclude that the hospitalization rate was reduced. Okay, the frequency was reduced, and um, the symptoms, the associated symptoms were reduced. Patient comes with better compliance and adherence to other standard medications, and they came up with better lifestyle. So the overall study demonstrated the potential effectiveness of dietary intervention in patients with dilated cardiomyopathy. So to conclude, advanced nutrition therapy plays a crucial role in managing dilated cardiomyopathy and improving patient outcomes. It emphasizes the importance of heart healthy diet, sodium restriction, fluid management, and weight management. Individualize the nutrition therapy plan based on each patient's needs, and do collaborate with multidisciplinary team for optimal care. Okay, all right. So this was from me. This was my presentation and the case study. I hope this would be very helpful for you all. And before wrapping up, I'd like to request my fellow dietitian to go through this Q&A, especially I have prepared for them. Have a glance over it, and do let me know if you have any further questions or query or confusions, or if you want to give some feedbacks. Okay, so these are the questions I have prepared. Please go through it. This will help alleviate any confusion if you have, and it will provide you with confidence when you are going to plan a diet for a patient with dilated cardiomyopathy. So please go through all the questions and answer. Okay. So here is all from me. I hope you all liked it and find it helpful. And thank you for your patience, your time, and please feel free to connect me if you have any questions or feedback. Thank you so much.